What are the eligibility criteria for COPD clinical trials? If you or someone you know is considering participating in a clinical trial for chronic obstructive pulmonary disease, you may be wondering about the eligibility criteria. These criteria are important for ensuring that participants are suitable for the study and that the results are reliable. Let's break down what you need to know. First and foremost, a verified diagnosis of chronic obstructive pulmonary disease is required. This diagnosis is typically confirmed through lung function tests, such as spirometry. This test measures how much air you can forcefully exhale in 1 second and your overall lung capacity. Participants are often classified using the Global Initiative for Chronic Obstructive Lung Disease staging system to determine the severity of their condition. Age is another factor. Most clinical trials focus on adults aged 40 years or older since chronic obstructive pulmonary disease primarily affects this age group. Next, smoking history plays a role. Since smoking is a major risk factor for this disease, many trials requiring a specific smoking history, often measured in pack years. This means the number of cigarette packs smoked per day multiplied by the number of years smoked. Some studies may also requiring that participants have stopped smoking for a certain period before joining. Baseline lung function is also assessed. Trials often set minimum thresholds for lung function, such as a specific percentage of predicted forced expiratory volume in 1 second. This helps standardize the participant's disease status and ensures safety during the trial. Stability of the disease is another key criterion. Participants usually need to be in a stable phase of chronic obstructive pulmonary disease, meaning they should not have experienced any recent exacerbations or hospitalizations within a defined timeframe, often 4 to 6 weeks before joining the trial. Certain coexisting medical conditions can lead to exclusion from the trial. Individuals with significant cardiovascular, renal, or metabolic diseases may be disqualified to minimize risks and avoid confusing the study results. Medication restrictions are also common. If a participant is taking medications that could interfere with the trial treatment or outcomes, they may not be eligible. Participants must also be able to comply with the study protocol. This includes attending scheduled visits and following treatment instructions. Geographic and logistic considerations are important too. Being close to the study site can help with follow-up and adherence. Finally, if someone has recently participated in another clinical trial, they may be excluded from joining a new one to avoid overlapping effects. These criteria help ensure safety and consistency among study participants. If you are interested in participating in a clinical trial, it is a good idea to discuss your eligibility with your healthcare provider. They can help you understand the specific requirements for each trial, as these can vary based on the study's goals. Participating in a clinical trial not only offers access to expert care but also contributes to advancing the knowledge of chronic obstructive pulmonary disease treatments.